Okay, so Shannon, just because I know the things that you're passionate about teaching from our conversations over the years, I want to give them a bonus. We're always on Philosopher Kings handing them either a belief, like a way to think about themselves and their professional environment differently, like a transformational belief, or we're giving them a toolkit, like emotional and relational tools that they can think, oh, I need to plug this formula in and it will change the dynamic. You have a really good way of thinking about loss, guilt, and shame. Loss, guilt, and shame. Can you just like imagine I'm a patient and I came in and I'm just dealing with a tangle of these things.
Yeah.
What would you tell me?
Yeah. Well, I think one of the first things we do, because it does feel like a tangle, these things, loss, guilt, and shame, they just feel like, I've had so many clients say, I just feel like a weight, or they're even sitting in the chair across from me like this. You know, you
like
can
in
just
their posture, like they're carrying
you can
something?
just see their weighed down. And so first we sort out and we name those things. So there's that loss, which goes, like we were talking about, goes so far beyond just someone in my life died, which may be part of it, but it may be the plans I had for myself didn't fall through. The relationship I wanted to have with this person in my life isn't what it should be.
Yeah.
There's a loss there. Then there's guilt, which is the idea of I have done something wrong and it is weighing on me. But where that can then shift into shame is it goes from I've done something wrong to I am wrong. There is something broken in me.
So you've taken a mistake and you've made it part of your identity.
Absolutely. Yeah.
And as a professional, you could see all three of those things happening.
Totally.
Maybe the career you envisioned for yourself does not feel like the reality of actually practicing, and you're actually grieving a loss. Or maybe you've made some mistakes, which we've said you will make, but you feel guilt over how you were not able to help a patient or a client. Or maybe you feel shame. You've taken, instead of the idea that Joe explained a couple of episodes ago, that failing is okay and we learn from it and we get up and we do better, you've come to see yourself as a failure and you're carrying shame for mistakes because you've taken the lesson on as an identity or yourself. What do you do with those things?
Yep. So exactly. Once we've kind of named them and we can identify them, what they feel like, what makes them each thing, then there's the prescription that loss needs grief, guilt needs forgiveness, shame needs truth. So kind of breaking that down with clients. If it's loss, sometimes it's naming this has been a loss.
Yeah.
And these are all the things I need to grieve because of it. I need to grieve that I didn't get the job I wanted. I didn't get to live in the place I wanted to. All my friends are doing this and I'm not. And we need to name and feel that grief, that sadness, and be okay with that. And then the guilt of needing forgiveness. Sometimes that means legitimately that there's someone, like I said, times that I've had to apologize to clients. We need forgiveness from another person.
Yeah.
Sometimes it's also forgiving ourselves, especially if it's not forgiveness maybe we're going to be able to receive from the person. And then shame is letting go of those pieces of our identity and countering it with truth. Like exactly what you're saying. If we start to take a failing and we label ourselves as a failure, then it's just like that. It's challenging that I made a mistake. I messed up in this area, but that does not define who I am.
Yeah. One of the things we ground ourselves in Philosopher Kings is that we're on a learner's path. That is, always have a beginner's heart, that there is more for me to learn in my field, more for me to learn in my discipline, more mountains for me to climb. I've never arrived, but have the self-compassion to know I'm on a learner's path, and ask yourself the question again and again, am I better this week than I was last week? And am I better this month than I was the month before? And man, I sure am better than when I was just a student, hoping that someday I could even dare to step into a room with a client or patient. And so a lot of times what we do is we look at the gap between who we would like to become as like some kind of perfect idealized provider, and we feel just great loss that we're not there yet, or we're not getting there fast enough. And we forget to look back and see we've climbed all of these mountains and walked all these hills and come all this way and we've actually gained so much. And you have to remember to look at the gain, not just the gap. Does that make sense?
Absolutely. I think, it makes me think a little bit about imposter syndrome, where we are maybe in the moment feel like, what am I doing here? How is anyone trusting me with this client or with this patient? I had a great professor that said at our graduation, when it comes to imposter syndrome, to remember that we did not fool them. That, there are people watching you throughout your profession and seeing that growth that maybe even we aren't seeing in the moment. But it is reassuring to remember, like, my first time sitting with a client and having those moments of, I absolutely have no idea what to say. Although sometimes it's best to not say anything anyway, so it kind of works in your favor. Or just say it sounds like a personal problem. Maybe not that.
I'm kidding. Okay.
But, just the difference in comfort level now, and it's only been a year, and there's still so much I don't know, but the fact that I can sit in those uncomfortable moments and that it's okay now.
Absolutely.
You'll survive them.
Well, this has been one of my favorite interviews, not just because you're my sister. So thank you for coming on the Philosopher Kings show.
Of course.
And I hope this was super helpful. All right. Bye, everyone.
Yeah.